Hi everyone, my name is Eric Reed, and today I'm going to be talking about stroke and brain injury. The definition of a stroke and brain injury: a stroke is a medical emergency in which blood flow to the brain stops, leading to the brain injury. Stroke and brain injury are closely related to the fact that stroke can cause a severe and chronic brain injury. There is a term called acquired brain injury, which has two subcategories: traumatic brain injury and a non-traumatic brain injury. A non-traumatic brain injury is an internal brain injury where a stroke could occur, whereas a traumatic brain injury is when someone hits their head or someone gets a concussion. That's a traumatic brain injury. So we're going to be focusing today on a stroke, which is an internal brain injury. What parts of the brain are injured, and how does that affect the person? Well, after a stroke, a left and right brain injuries can occur. The largest part of the brain, which is the cerebral cortex, has two hemispheres: a left hemisphere and a right hemisphere. The right hemisphere of the brain controls cognition, emotions, and spatial perception, which helps the person kind of balance and keeps their center of balance maintained, so they don't fall over. Whereas a left hemisphere controls language. More specifically, an individual's ability to talk and receptive language skills, ability to understand what everyone is saying on a daily basis. Right-sided brain injuries versus left-sided brain injuries. So right-sided brain injuries can affect an individual's everyday abilities, such as poor judgment and short-term memory loss, such as dementia. And dementia is long-term memory loss. Right-sided stroke patients have a hard time with speech pronunciation because of the weakness and lack of control in the muscles located on the left side of their mouth and face. This is known as dysarthria. Here in the illustration, it shows a individual with a stroke and what happens physiologically in their body, and I'll explain that later on. Left-sided stroke patients can experience other forms of communication disorders, such as understanding or expressive abilities, or the ability to get words out. This is known as aphasia. Patients with left-sided brain injuries from a stroke can also experience slurred speech from the right side of their face. If someone has a left-sided stroke injury, it's going to affect their opposite side of the body, as well as mouth weakness. So that's known as dysarthria, which we covered in the previous slide. So there's an acronym called FAST, and FAST is a good assessment tool for EMT providers as well as nurses or doctors to assess a stroke and see the signs and symptoms of a stroke. So the F is facial, so if you ask someone to smile, and if they have a droop on one side of their mouth, that's a positive sign of a stroke. Arm weakness: if the patient closes their eyes and lifts both arms up and one side of the arm droops, then that falls down, then that's another sign, as well as speech difficulties. If any of these occur, if any of these are positive in the assessment, then that provider or that healthcare provider or bystander should call 911 immediately. Stroke risk factors. So there are modifiable risk factors and non-modifiable risk factors. So there's risk factors that are controlled, whereas non-modifiable are not controlled. So non-modifiable are age, gender, ethnicity, and if someone's had a previous stroke in the past. So in age, the cerebral artery as you age stiffens and hardens, and this leads to high blood pressure, known as hypertension, and a greater risk for developing a stroke. The age range for people who have a greater risk of stroke is 65 and older. Men are at a greater risk for developing a stroke than women. And also ethnicity. So African Americans are at a greater risk of developing a stroke since they tend to have higher blood pressure, which puts them at a greater risk for developing a stroke. And we can explain the definition of hypertension and how that really affects the person's body for developing a stroke. If someone has had a previous stroke, then they are more likely to get another stroke. The second time is very more common to get a stroke. So the modifiable risk factors are something that are risk factors that you can change. So hypertension is an example. So the definition of hypertension is the narrowing of the blood vessels from the plaque buildup that leads to obstruction in the cerebral artery in the brain, which leads to a embolism, which is a clot in the brain, which gets sent up to the brain and leads to the stroke. There's also hypoxia, which is a deficit of oxygen in the brain tissue, resulting in the stroke. Diabetes is the excessive amount of blood sugar, which is the glucose molecules in the brain, that if they're floating in the cerebral artery, if they're floating in the blood vessels, that damages the blood vessel walls, making them hard and stiff. Like we talked about earlier with age, as you age, there's the cerebral artery gets stiffened and hardens, which is a really bad sign for developing a stroke. And this plaque buildup is known as atherosclerosis, creating blood clots and resulting in a stroke. And high cholesterol levels as well. LDL levels are bad cholesterol levels. If that builds up a lot in the brain, blood vessel walls, this could lead to an excessive amount of plaque buildup. So today we're going to talk about a little bit of stroke epidemiology. Stroke is a highly prevalent condition. It's a part of the dreaded Ds because stroke is the leading cause of chronic disability. It's the leading cause of, second leading cause of dementia, and it's a fourth leading cause of death in the United States. The prevalence of stroke in the U.S. takes about 3% of the adult population, which approximately has 7 million individuals affected. You can kind of think about that and do the math on that one, but that's a lot of people affected in the world, in the U.S., in the adult population for stroke. The incidence of stroke dramatically increases with age. So as after you turn 55, the incidence or the likelihood of stroke developing actually doubles. So once you turn 55, you have a significant increase for developing a stroke. Okay, so there's 3 types of strokes that we'll be talking about. There's ischemic stroke, hemorrhagic stroke, and transient ischemic attack. So ischemic stroke is the most common type of stroke. This cause of stroke is when a blood clot obstructs a blood vessel in the brain, leading to a stroke. It's the narrowing of the arterial wall, cerebral artery wall, that there's not enough, there's too much plaque buildup in there, and blood flow actually impedes, so it stops, leading to that stroke. Hemorrhagic stroke is a very fatal stroke. It's actually they're less common, but they could be fatal. The occurrence is a weakened blood vessel in the brain bursts, leading to a brain aneurysm, which could lead to intracranial bleeding within the brain. So this is a very serious medical emergency that you have to transport this patient as soon as possible by helicopter or any way to get to the nearest high level 1 stroke center. Transient ischemic attack is a TIA, so causes similar symptoms to an actual stroke. The blood flow is on and off to the brain, so when the blood flow stops, or when there is blood flow, the symptoms disappear. When there's no blood flow, then that leads to the stroke. And TIAs actually they only last about less than 24 hours, so you can still show the signs of a stroke, but they only last less than 24 hours. That's known as a transient ischemic attack. So a little pathophysiology on stroke. So pathophysiology is a study of how a condition, in this case a stroke, affects the body. So a stroke, like we said, is a sudden onset of weakness, numbness, paralysis, slurred speech, which is aphasia, which is without speech, and problems with vision and other manifestations of a sudden interruption of blood flow to a particular area of the brain. Someone with a heart condition known as atrial fibrillation, or AFib, has a higher risk of developing a stroke if they have an underlying heart condition. In this case, in AFib, the atria in the heart do not contract properly, which leads to quivering, and this could lead to a stroke or a myocardial infarction, which is a heart attack. Blood that sticks around in the left atrium starts to clot and blood flow is obstructed, which leads to the clot can travel up to the brain. So stroke has some medications. So warfarin, also known as Coumadin, is an anticoagulant medication that is used to prevent or treat clots in the veins, arteries, lungs, or the heart. Warfarin can help prevent blood clots forming, as well as reducing the incidence of an embolism or a clot that migrates to vital organs such as the brain. Here are some precautions for a patient who that should not take warfarin if they have high blood pressure, recent surgery, or undergo a lumbar spinal tap. Warfarin is a blood thinner and it can cause an increase in bleeding because it prevents blood from clotting, so you should take that in mind as well. Some medication. So there's a 25 to 35% of having a second stroke if you had a previous one. So that goes back to what I was saying earlier. If you've had a stroke before, you should take caution in making sure you're on the right medications. Doctors would want to prevent the stroke by giving blood pressure medications because high blood pressure, hypertension can lead to a stroke. Here are some examples. ACE inhibitors, essentially a heart medication that dilates your blood vessels, widens them to create that pathway in the cerebral artery to be able to prevent obstruction. And antiplatelet medications are important in helping to prevent clots and assist in platelets from sticking together. And aspirin is a common medication for this. So my case study, I did a 57-year-old African-American female who was diagnosed with an ischemic stroke. Before her stroke, she did exercise on a regular basis for at least 3 days a week, 3 times a week for 3 months at moderate intensity. Her mother had a history of atrial fibrillation, so like we said in the previous slides, atrial fibrillation, if underlying heart condition, has an increased risk for that person having a stroke. And this was diagnosed at age 55, so this is per ACSM risk stratifications. She has high cholesterol, which has a major effect on the plaque buildup. Her LDL levels are 38 milligrams per deciliter. She's a non-smoker. Her LDL levels are 55 milligrams per deciliter. Her blood glucose is 98 milligrams per deciliter, and blood pressure is 158 over 92. So based on my patient's profile, she has 4 risk factors. She is greater than 55, she's 57, high cholesterol, hypertension, which is the main reason why she had this stroke, this ischemic stroke. She has moderate risk for exercise based on her number of risk factors, which is greater than 2. During her exercise prescription, she should be monitored very closely. So the exercise testing prescription, before beginning any type of rehabilitation program for any stroke patient, is important to test their sensory functions and reflexes before getting into any sort of program here, because it's most likely compromised from the stroke. This would be done as a safety precaution for the patient to make sure they're fully able to participate in the exercise program. And there's some important tests to aerobic endurance there. The prescription, I'm going to have my patient do a proper warm-up that likely involves some breathing exercises. First, I'm going to have my patient improve their mobility, balance, reaction time, and strength and aerobic endurance, because these are very important in the rehabilitation of people coming off a stroke. Strength exercises should be 3 sets of 10 to 12 reps, and the balance should hold about 30-second hold, 2 to 3 sets as well. I would also like to focus on a hand grip strengthening exercise to be able to strengthen the hand muscles that were lost from the stroke. The strength of the muscles that were lost in the stroke. So that would be a good part of my exercise prescription. And my aerobic exercises should be twice a week with a 15 to 20 minute duration. I would like to conclude that I thought this presentation and research from doing this presentation was very interesting. It would be useful for my EMT field as furthering my knowledge in the medical field as well. I'm glad I was able to learn more information about a stroke and how it affects the brain. I hope you guys have also learned something from my presentation, and I thank you for listening and watching my presentation. Thank you guys, and I'll see you later. Bye-bye. And here are my references right here. Thank you.